When we were first leaving the hospital, they said that I would have to go to rehab, and I just wanted to go home. You know, who wants to go to rehab? But now, I want to stay here. I don't want to go home because I get what I need here, and I'm making progress here, and I don't think I'd make that kind of progress at home. You wouldn't think you'd want to be in the hospital, but this feels like home.
It's not just a professional investment. They make a very personal investment in the families that they work with.
When your child is given a death sentence, literally in my case, and you bring your child to Casa Colina and your child starts thriving, you just feel empowered. I feel very empowered here. I feel very, very supported.
The people that have come into my life are absolutely amazing.
I just feel like these people are really part of our extended family now. We will never forget them.
Never?
Never.
Welcome to Casa Colina. Our intention is to practice rehabilitation and medicine at a level that goes far beyond expectation. Our mission is that every patient reach maximum medical recovery and rehabilitation potential. These are the staff who make it happen. More than 700 people dedicated to one common goal, patient care. This team treats more than 10,000 patients a year, a 50% increase since 1998. And we've built a wonderful new campus. But the numbers and the buildings are not the most important thing. The key is that we treat each person, one at a time, working on the unique problems of each individual. Each patient is an inspirational story to all of us.
1936. The technological advance of the iron lung made it possible for children to survive polio. But what kind of life was it? Frances Eleanor Smith, Mother Smith, gathered local citizens to help the growing population of children who were cured of polio but were permanently disabled. They founded Casa Colina to do the work of rehabilitation, and we have been doing that work ever since. We expanded the original home of Casa Colina in Chino until it could grow no further. In 1960, we moved to Pomona. The new hospital was designed for children but converted for adults even before it was finished because polio had been wiped out by the new vaccines. And advances in trauma care meant many more adults were surviving accidents and diseases but were left with disabilities. Casa Colina became a nationally recognized center for the treatment of brain injury, stroke, spinal cord injury, and many other disabling conditions. 40 years later, the world had changed again, and Casa Colina had a rebirth and a new dedication to the basic principles of medical leadership and inpatient rehabilitation hospital service. Completed in 2005 as the flagship of a total campus renovation, Casa Colina Hospital created a place of healing and recovery. There are 68 beds in private and semi-private rooms, built to the highest seismic standards. Lush landscaping, internal gardens, and cafe-style dining create an environment that's both welcoming and relaxing, an experience unlike any other hospital. Casa Colina is a fully licensed acute care hospital and accredited by Joint Commission with pharmacy, laboratory, complete imaging services, and the hyperbaric service with its special focus on wound care. There are 250 physicians on staff with the best specialists for consults, nursing staff with specialized rehabilitation skills, physical, occupational, and speech therapists with advanced training, neuropsychologists, and other professionals, and all the support staff to help these people perform at their highest level. Housekeepers, engineers, cooks, receptionists, medical records. In addition, Casa Colina exceeds standards as an inpatient rehabilitation facility with 3 hours of therapy for each patient every weekday, nursing and medical oversight at inpatient hospital standards, treatment organized by multidisciplinary teams, all working according to proven clinical pathways. And that's what makes it special. This is an organized approach that focuses on the recovery of each patient one at a time.
My name is Tanisha Jones, and I'm 35 years old. On January 21st, 2009, I was diagnosed with pneumococcal pneumonia. I noticed that my fingertips and my toenails started to turn very dark. Before I knew it, The darkness had spread up my fingernails and up my toes, up to my legs. My forelimbs were amputated on February 20th. There was a period of where I felt down and I was crying all the time. Who could live with no limbs? This rehab center has been a great asset to me. My first day, they asked me, "What is your goal?" My goal is to become functional and independent. I said, "You know what, Tanisha, you've got to burn it up." I said, "It's time to just burn it up," meaning you've got to kick butt in therapy. I can do so many things that I never thought I could do. For example, I can feed myself again now. I can dress myself. These are things that I never thought that I would be able to do.
Nice. Nice.
We're proud of what we've accomplished at Casa Colina Hospital for the patients we serve. But there's another vital aspect to Casa Colina that separates us from other rehabilitation systems, and that is our comprehensive continuum of care, a system of distinct levels of care that provide the most appropriate intervention strategies to an individual at a particular point along their recovery. A network of services that truly serves the needs of people with disabilities.
The Transitional Living Center makes Casa Colina a leader by providing a critical step beyond hospital rehabilitation for people with brain injury, spinal cord injury, and other conditions. It is a transition from being a patient to being a person. Clients have the extended time and the expert support of the whole rehab team to learn the skills that will help them be successful as they rejoin families and re-enter community living. The residence-like setting and the frequent out trips give clients the opportunity to practice new skills in environments like the homes and communities they will be going to, and therapy can also extend to the home itself to help ensure success for each and every patient.
I'm ready to go home and know that I could be cared for, you know what I mean, that I could live at home, that I could go back to work, because they've really trained everybody to do everything that they do.
Years ago, people with spinal cord injuries were in a chair for the rest of their life, with somebody taking care of their every need. I don't feel like that's going to be Lisa. It's not now.
We can go to the movies, we can go anywhere we want to go because they've showed us how to get in and out of the car, and they lend us the equipment we need to do it, and so it's been really nice. You know, at the hospital, you don't even get to go out of your room.
I think anything that you can possibly think of to help a patient help themselves has been done here.
The Dr. S. Jerome and Judith D. Tampkin Outpatient Center has a full spectrum of outpatient therapy options. There are specialized facilities for orthopedic, neurologic, speech, hand, sports and aquatic therapies, and an advanced audiology suite. In addition, board-certified specialists in the physician clinics are an incredible resource for people with disabilities and the whole community. They bring their medical expertise and leadership to dealing with arthritis, MS, Parkinson's, orthopedics, sports injuries, infectious disease, wound care, pain management, balance, and many more conditions. At Casa Colina, physicians and therapists under the same roof apply themselves to working with each patient, one by one, to ensure that each person becomes a success story. Children's Services helps children with special needs take on the challenges of developing so that they can become the best they can be in school and in later life. Early intervention for younger children with developmental needs and pediatric rehabilitation programs address the explosion in number of children with autism, as well as many other conditions that children are born with or that they acquire in growing up, including physical, thinking, social, speaking, and learning needs.
You have a child that was sent to you with, you feel like a death sentence. Literally, she's terminally ill, that's what they said. Being here at Casa Colina, we've learned that she's not blind, that she is not deaf, that she's developed 4 words of speech. She interacts very well with the other children, and she's just kind of blossomed. When you look in her face and you look in her eyes, she is so engaging. They treat her not as if she's a client, she's not a patient, she's Fatima.
The sleep lab allows physicians to diagnose and treat sleep problems that can have a profound impact on many aspects of a patient's life and ability to recover. Adult day healthcare helps clients maintain their abilities to think, be active, and participate in life in safety and security and with medical supervision. With the family member attending adult day healthcare, the rest of the family can take care of their daily business and keep the loved one living among them. The Cattell Imaging Center offers a full array of diagnostic and interventional imaging technology, including CT and MRI scanners, conventional and digital X-ray, fluoroscopy, bone densitometry, and mammography. Just next door is the Casa Colina Surgery Center, with surgery suites and procedure rooms for ambulatory surgery. The state-of-the-art facility allows surgeons to have complete control over the quality of care their patients receive. And in Azusa, there is a full range of outpatient therapies at Casa Colina's first satellite facility. Opened in 2008, this treatment location offers all of Casa Colina's physical, occupational, and speech therapy modalities and specialized physician services, with greater convenience for patients in the Western Foothill communities. Rancho San Antonio Rehabilitation is part of Casa Colina's management of all of San Antonio Community Hospital's rehabilitation services and brings the same high level of outpatient therapy services to our communities east of Pomona as we do at our main campus. The Padua Village Homes are residences where adults with intellectual or developmental disabilities live a life that has work, pleasure, friends, and dignity, as well as medical oversight and an active wellness promotion program. Casa Colina Apple Valley and Rancho Pino Verde are residences in the high desert where 76 adults with brain injury can live with as much freedom and challenge as they can manage. Apple Valley has access to community activities, and the ranch has animals and opportunities for daily chores on site as well as recreation. Both locations offer the potential for personal growth, security, and comradeship. Outdoor Adventures helps people achieve the final goal of getting back into the community and living a full life. This acclaimed program for Casa Colina patients and people from the community assists them as they take risks and experience challenges in the outdoors. With more than 100 days of activities a year for children and adults, these adventures give people the chance to succeed on their own, build confidence, enjoy teamwork, and begin to live a life beyond disability.
Casa Colina is committed to raising the bar in rehabilitation and healthcare by continuously raising the bar on ourselves. The board of directors has chosen a strategy of backing our doctors, our nurses, our clinical support staff, as well as administration in everything they do to create a center of excellence and put the well-being of the patient first. You can have a hand in making this happen, and with your help, we can make these differences in the lives of every single individual that entrust themselves to our care now and far into the future.